All right. If you're a senior, or maybe approaching being a senior, and you are interested or you need eye care, which most of us do need as we get older, our vision gets worse. I mean, I was born with 20/20. I still test with 20/20, but clearly I wear glasses, right? So I do need some help seeing, and I don't think I'm alone. I think there are many people kind of in this same situation. So it is interesting to look to sort of see. Medicaid does try to fill that gap. But before we get to Medicaid, I will chat a little bit about Medicare. Medicare generally does not cover vision. If you go on a Medicare Advantage plan, a private Medicare plan, you will most likely get some basic eye exam, maybe even some glasses coverage, and you'll definitely get preventative dental in most of those plans as well, right? So that's one of the big selling points of Medicare Advantage is that you get kind of more of a holistic coverage, whereas traditional Medicare, you don't get it, right? So if you're on traditional Medicare and you are able to qualify for a Medicaid fee-for-service program, there are a certain number of states where you will get some benefits, right? If you qualify for the Medicaid program. Exams are either covered annually, exams and glasses. So, you can see the states that, like New Jersey, it looks like Ohio, Wisconsin, Arizona, very good. Exam and glasses are covered every 2 years. I think that's more common than every year. Not sure that yearly, unless you lose them or there's some other issue, is really going to help you too much. But and then you can see it goes all the way down to no coverage. States like Arizona, New Mexico, Oklahoma, Louisiana, Georgia, looks like they don't offer any coverage whatsoever, right? One thing you may or may not know is Medicaid is not administered federally, so that's why you see a lot of variation between the states. The states get to decide what they want to cover and what they don't want to cover. They do share the funding with the federal government. It's typically a 50/50. And so just be aware of that. Where you live does matter because with regard to the services that you're eligible for. And this is just another example of that.